You got to tell the story. Brooklyn Borough President Eric Adams.
Okay. So Eric Adams was 50 plus pounds overweight. And he had an A1C that was really high, his 3-month sugar. He was given insulin and metformin to start. And he never took the insulin because he just was afraid of insulin. And then he did take the metformin for about 2 weeks, but it made him sick. And it gave him that stomach ache that a lot of people get from metformin. Then you get over it potentially, but he didn't want to get over it. And he was determined to figure out how to do this. And so he said there was blurry vision. He had numbness and tingling in his feet. He had also gone to, very smartly, he had read some, I don't want to take full credit for Eric, but I want to say that he went to Dr. Esselstyn, Caldwell Esselstyn, Essie, as everybody refers to him, at one of his seminars for a day and listened to him. And he read some of Dr. Michael Greger's stuff. Mm-hmm. And so that was wonderful. So I got someone who was a zealot and he really wanted to change. And he's done wonderful things. And his A1C is close to normal, if not normal at this point. And he has no more symptoms, and he's lost all the weight, and he continues to. And I look at the body analysis, and I keep tweaking things, and he's like, this is great. And I'm tweaking things for him, and he's getting better, and he's getting better, and he's getting better. And he just keeps getting more and more excited, and he keeps trying things, and he keeps questioning what we're doing, and we keep altering, and he keeps getting better, and he keeps getting better. But now he's like 1/10 of 1 point away from being non-diabetic on the A1C level. Now his mom is 79 years old, and obviously diabetes runs in his family. And she was on 2 insulins and 2 other diabetes medications.
And he talks about him remembering when he was a young child, her using insulin. So she's been this way for a long time.
She's been this way for years and years and years. There was a trial called the Accord trial, and there was another trial called the Advance trial. They were both trials published in the New England Journal of Medicine. Mm-hmm. That little rag that nobody knows.
Right, yeah.
There were 10,000 people in both trials, and they were randomized controlled trials.
Wow.
And someone had the brilliant idea of, can we bring these people down to non-diabetic levels? Now, what they called non-diabetic levels were really pre-diabetes, less than 6.0 on the A1C, because right now the standard's 7.0.
And do that with medication.
This is all about medication. Yeah. And so they got to about 6.4 or 6.5, and they had to stop. Because
why?
I'm glad you asked. Because more patients died from polypharmacy, and they were on an average of 4 hypoglycemic medications.
Yes.
And that's 4 diabetes medications. Yes. And 4 diabetes medications seems like a lot, but it's not. A lot of diabetes patients are on 3, 4, 5 medications. After a month of starting the diet, I get a call from Eric, and he says, should we cut the insulin? And I said, why do you say that? And he said, because the sugars are running around 70 and 60, 70. I'm like, holy crap, we should cut the insulin right away. Now, I didn't expect her to do so well right away because her mobility is not the greatest and everything else. And I thought that was going to affect how she eats, how she does it, everything that was going on. Oh my God, she was great. She's a wonderful woman. Not to mention she's a wonderful woman in terms of personality. And she's wonderful all around to work with. But she jumped onto the bandwagon. And she dropped 2 insulins in a month. And she has, and her A1C has dropped to near non-diabetic levels. She's pre-diabetic, but it's dropped to near non-diabetic levels. And she's not on insulin anymore. And we're ready to take her off the other medications. And it's only been about 3 or 4 months. It's only been about 3 or 4 months. But not only that, we cut the cholesterol med in half just recently because she's doing so well, and we're going to cut it down even more. And the only reason I didn't cut it down even more is because she still has inflammation, but her inflammation went dramatically down. Her CRP, which we were using, had been around double digits around 12, 13. It's now around 2. Ideally, you want it less than 1 to be optimal. To be average, which is kind of ironic because the labs will say 1 to 3 is normal and it's called average. But to be optimal, you have to be less than 1. And so we want to get her less than 2 at least before we cut more of the statin.